Well, we now know that 75% of new coronavirus cases in the United States are being reported as the Omicron variant. Doctors say the first death from Omicron was a man in Texas who had had the coronavirus previously but was unvaccinated. While Omicron is not prevalent in Alabama, only one case that we know of, it has been predicted to be the dominant strain worldwide by the new year. WDHN's Cody Giles joins us now live in the newsroom with how and when Omicron could affect us here in the Wiregrass. Cody?
Amanda, while only one person has been diagnosed with the Omicron variant so far here in Alabama, the contagion infection rates of this virus are higher than the Delta variant, making it possibly more dangerous.
For what we know right now, is very easily to transmit. Probably it looks like it's much more easy to transmit than even the Delta variant. We're not sure at this point, is it going to cause more severe illness? But even if it's as severe as the Delta, then we still have the possibility for a lot of sick people. The simple fact that it's easier to transmit does make it a little harder to handle.
Statistics show statewide hospitalizations due to the coronavirus are up more than 50% from a month ago. This graphic from the University of Alabama at Birmingham says 35 patients are hospitalized in Alabama due to coronavirus, and 29 of those are not vaccinated. 11 patients are in the ICU with COVID, and 8 are on ventilators. President Biden announced plans to send 500 million free rapid COVID tests to Americans. He's also prepared to deploy specially trained troops to help areas heavily impacted.
That's 1,000 military doctors, nurses, and medics.
Kirkland says while special actions aren't being taken here now, but with about 75% of the cases now being Omicron variant, if it becomes prevalent in the Wiregrass, special actions will need to be taken to keep everyone safe.
About 3/4 nationally is what is being reported of cases, which has come up just in the last 30-45 days.
And with outdoor temperatures dropping and flu season upon us, doctors also are emphasizing the importance of getting the flu shot to protect yourself as well.
Whether or not it's the flu shot that I'm about to get right now, or the Johnson & Johnson, the Moderna, or the Pfizer vaccine, it's important to get vaccinated, not only to protect yourself, but to protect everyone else around you.
Kirkland says more people are getting vaccinated against the flu this year than in 2020, and he equates that to more people getting out this year. He even says you could possibly get both the COVID and the flu vaccines at the same time.
Certainly encourage people to get both. There's no indication about not getting the two vaccines together now as well, so you could possibly get that in one visit if you wanted to.
Local pharmacists remind those who do arrive to get their vaccines or flu shots to be sure to wear short sleeve shirts, as I had the issue earlier today, as it'll make the injection easier, more convenient, and less time consuming. Back to you, Amanda.
All right.